Thank you. And thank you so much for our opening words and for all of you being here today. So as David mentioned, my name's Linette Scott. I'm serving as the Interim Deputy Secretary for Health IT. And part of what that means is serving as the HIT coordinator for our state HIE Cooperative Agreement Grant. And part of that means coordination, as he said. And so this really is a very exciting day for us at the state, at the agency, at Cali Connect. And I really want to take a few moments to acknowledge the incredible work that's happened by the staff at Cali Connect, as well as the really huge cross-section of folks that have worked with them to make today happen. David and Don from our chairs of Cali Connect really kicked it off, but it's been a huge team effort, and I really want to thank folks both for coming and for the planning and putting things together that came together to make today happen. And one of the things I'd like to encourage all of you to do is make sure you reach out and meet some new people today. Don't just talk to the people you know, but also find the people you don't. And there will be a little bit of activity. This is going to be a little bit of an interactive conversation, so you'll get to see who you might want to meet. So I am very privileged and have really had the honor to serve in the interim role over the last 10 months now, I think. And I am still working at the Department of Public Health. But my passion for this really comes out of some of the experience I had before coming here, as well as the experience here. I actually went to medical school to do pediatrics, to work with children. After my internship, the Navy said, who paid for medical school, they said, thank you very much, but you're going to go out with the ship. So I spent a couple years with the destroyers and the cruisers and the frigates off in the Mediterranean, and then a couple years in an active duty clinic before then leaving the service and coming out to California. And now I'm board certified in general preventive medicine and public health. But during that time, when I was working in the military, there were two particular care environments that I got to work in. One was a partial EHR. We had our paper records, but we did have electronic labs, electronic medications, electronic ordering for referrals. And so even when the patient showed up without their chart, because it was on the ship and we were on shore, by looking in the computer, I could get a pretty good history pretty quickly and still take care of that patient. But I also did some moonlighting at a clinic that was actually set up by a military doc that turned into a chain on the East Coast called Patient First. And it was entirely electronic. The only piece of paper was the prescription that I had to sign. That was it. And it was a fantastic experience to be able to work with patients and be able to give them choices and say, would you like to get that medication here for $6, or do you want to go to CVS or wherever you go get your pharmacy filled? To be able to have that decision support to say, if you charge a $99,204 for the medical coding on this, you better have done this, this, and this on your physical exam so you don't get charged with fraud. That kind of decision support to help in the interaction with the patient and to help in the way that I delivered and documented care was invaluable. And so because of that, and that was a decade ago, if I were actually doing clinical work now, there's no way I'd practice without an EHR. There's just no way. And so part of the transformation that I see happening, and my personal estimation is in 10 years there will be a new norm. And part of that is because as people do get a chance to work with an electronic health record, when it is structured to give them that kind of decision support, it really does help with patient care. Also, folks coming out of training, everybody's got their iPhone, their iPad. People don't take notes anymore. They do it on their touchpad screen. They're not going to work without an electronic system. So as we do this transition, we're going to be supporting paper environments and electronic environments, but I think the transformation is really happening. So that becomes then the challenge for us now is how do we keep that moving? How do we move it along? And how do we do it in the way that makes the right choice the easy choice and really hits that safe and effective, as the video said at the very beginning. So I want to step through a few ideas here that share with you the spectrum of things that are occurring throughout the state and that tie into the national work. and where these things fit together. So we have sort of a shared base. And then I'm going to turn it over to Laura Landry, who's serving as the interim CEO for Cali Connect and is really doing a phenomenal job there as well, to talk more specifically about some of the health information exchange activities that are happening in the state and where we're going. And then after that, we'll be moving into the time period where we really get your input. And the day is structured so there's some presentations, but we also really want to give you some chance to meet with each other, talk with each other, bring those ideas up, and share back with us where we should be directing these resources. Because yes, they are finite resources, but they are significant resources to really kick off this transformation in an accelerated way. And that's really what the stimulus bill was all about, was stimulating. Not paying for the whole thing, but kickstarting it and getting us moving. So in California, one of the things that I really appreciate that my predecessor, Jonah Froelich, did as he kicked off this whole endeavor with the vast team here is that he really emphasized this is not an IT project. This is about how we're changing the way we deliver healthcare, how we deliver business, and always kicking off with our purpose to dramatically improve safe and secure patient and provider access to personal and population health information and decision-making processes benefiting the health and well-being, safety, efficiency, and quality of care for all Californians. And that really is our purpose that keeps us coming together. IT will be critical to support it, but it's not an IT project. It's really about how we deliver care and provide our services. So as we do this, I have to throw in a little bit of the public health piece here. In the 1900 to 2000, there were a few accomplishments that we achieved as a community, as a nation, and they were things that really made a huge difference in health and well-being. Some of them directly related to medical care, things like vaccination, controlling infectious diseases, and others really related to the community in which we live, which really affects how our health is. Things like having safer and healthier foods, fluoridation of drinking water, recognizing that a safer workplace and motor vehicle safety will make a difference. Those are things that are huge accomplishments over the last century. We're going to have another list for the next century. Care goes beyond the doctor's office. In the doctor's office, we have 5, 10, 15 minutes to visit with the patient. The change happens not just there, but also once they leave there. It's the community, it's the place we live. And so how we integrate not just the EHR to EHR, but the EHR and the information that's there about a patient so they take ownership of it and integrates with those other activities that really help encourage their health. The community services, the outreach, the support systems. And so it goes beyond the doctor's office. And I think that's another part that's really important to keep in mind, and that the idea of electronic health exchange, health information exchange, gives us opportunities to think about that in a new way. Obviously, personal health information, the particular confidential information is confidential, but there's other aspects for integrating service delivery that go well beyond the doctor's office. So we're on this adventure to change the environment. On the technical side, business process redesign and all that kind of stuff that goes with it. From the doctor's office to the way we deliver care in the community to the way we deliver state government care, local government care, and services. So we're under a huge business process change effort, changing the environment. We're looking to create this new norm. What is it that we should expect? In California, with Kaiser leading the way, they've already got the billboards up about saving the forests with electronic health records. They've been helping to set a new norm in a way that other parts of the country haven't quite experienced yet, and really have been a leader, which also makes the rest of the country think that everybody looks like Kaiser, which is not the case, which is part of why we're all here as well. Kaiser is a true leader and a true partner, but there's a lot of other environments that aren't even close. And that's part of what we're here for, is to help bring all the different pieces along and connecting them together. Prevention addressing social determinants. So this is kind of our core public health language. What are those things that affect the way your health is that you may or may not control? And it's understanding that where we live really does affect our health. The kind of food availability, the kind of schools that you're attending, the work environment, the transportation, those things that do affect our health and again go beyond the doctor's office. I had the wonderful opportunity to attend a meeting a couple weeks ago with the Administrative Office of Courts that was really taking a lead and focusing around child welfare issues and foster children. And there was an expression that was shared there, courageous impatience. And that just was such a wonderful phrase, that what is that courageous impatience that lets us tackle the hard questions, dive into them, be patient with each other, and yet keep it moving forward. And of course, an underpinning for everything is quality. We're hearing that in all kinds of environments, from the federal level, the state level. How do we improve quality and do it in a way that is cost-effective and really helps improve care? So one of the things that I think we tend to get lost in a little bit as we get into some of the details of what this whole process, EHR incentive program, meaningful use, 25 measures, core, menu, all these kinds of things that I know a lot of you are really familiar with. But we tend to not jump back up to the top, which is the 5 policy priority areas. All of those meaningful use measures fit into these 5 goals that were really outlined as part of the final CMS Stage 1 rule for meaningful use. And I think these are some of the drivers. So as we think about where we're going, knowing that Stage 2 and Stage 3 are coming, what does this mean? This makes it in a language that's a little easier for us to understand, that goes beyond, again, the detail of the measures. But improving quality, safety, efficiency, and reducing health disparities. I mean, that's a big goal. We know that's a big goal. Engaging patients and families in their health care. This one in particular, we haven't heard as much about, I think. But again, we have a breakout session this afternoon that's going to be focusing in on this one, some consumer engagement conversation. But this is really critical. I mean, it goes back to how do you as a patient, as a family member, as somebody who's caring about another individual, help take care of them and be able to be engaged. Improving care coordination, and that's, of course, Health Information Exchange 101. Coordinating care between providers. Improving population and public health. It started out a little bit slow with reporting to public health, but it's really about the target of where we might be going in Stage 3. How do we understand what's affecting the population and help them stay healthy? And of course, ensuring adequate privacy, security, protections for personal health information. We all know that that's absolutely core. I know that there's going to be some more news articles coming out around that area this week, the Institute of Medicine report that's coming out. And so we know that that's absolutely critical, to have the trust of patients, of providers, to know that the information's moving safely and securely is absolutely critical. And so that's something that we're all committed to really working on over the next year and looking at what are the avenues to address that and really look at the issues here in the state that are maybe state-specific, and the federal level is also really diving into this in a more serious way, I think.